Just to run you through the agenda for this morning, I just want to introduce myself. My name is Jennifer Jenkins, and I'm a specialist health improvement practitioner for the Wellbeing team, part of Live Well South West. Shortly, I'm just going to give you a very quick update on what's going on at Wellbeing at Work. And then I'm going to hand over to my colleague, Nita Dodd, who's going to take you through menopause in the workplace. We've scheduled some time for questions and discussion, but please feel free to ask questions throughout, either putting things into the chat bar or by raising your hand, and we can ask questions throughout. The usual housekeeping rules for webinars, but just to let you know that all the presentations will be sent out afterwards to all of the attendees, and we will be recording the session. So if you have got colleagues that haven't been able to make it today, they can watch this back on our YouTube channel. So just to give you a very brief overview, if you're brand new to Wellbeing at Work, we offer 3 programmes: training, awards and champions. And if you'd like to be involved in any of those things, please do get in contact with us and we'll be able to get you involved. And just to let you know, the champions are continuing to take over the city of Plymouth. We now have 542 champions, which is fantastic news. Again, if you'd like to be involved, please get in touch. We've got some new training coming up, so look out for information in on our social media and in our newsletters. But this is brand new training, and we think it's going to be incredibly popular, free to access, and so please get involved with that when you see it being advertised. I want to say congratulations to one of our local businesses, Push, to continue to receive their bronze award. And we've got some new businesses we just want to say hello and welcome to, who have just made some connections with us. If you are receiving our newsletter, you'll know that we have an event coming up at the New Continental Hotel. It's called Plymouth Wellbeing Connections. We have 36 partner stands that are going to be at the event. So it's all about health and wellbeing services available for you to connect with within Plymouth. We'll be there, so please come and say hello. And we have got free tea and coffee and a piece of fruit to keep you going. So please do think about popping down and coming to the event. We also have 3 webinars coming up as well. Money and loan shark awareness, gambling harms, very appropriate for the cost of living crisis, and they're very good sessions. So if you haven't been to one before, we do encourage you to sign up. And we also have alcohol awareness coming up in January, which ties in with Dry January and making a positive lifestyle change. And just one further thing, which I haven't included, is that the Menopause in the Workplace session today, if it's something that you would like to offer within your business, then we can do this. So please do get in touch if you would like to have this session delivered in your workplace. It's normally delivered virtually, so please do contact us if that's of interest to you. So I'm now going to pass over to my colleague Nita, who's going to take you through menopause in the workplace. So I'll just stop sharing. Has that worked? Brilliant.
Morning, everyone. I'm just looking at sharing my slides now. Hopefully you will see them very shortly. Can somebody just confirm that you can see those okay?
Yes, that's fine, Nita.
Brilliant. Thank you very much. So thank you very much for joining me today, and thank you to Wellbeing at Work for inviting me. I was asked to develop this presentation last year, actually, to coincide with Menopause Awareness Month. And obviously, the subject of menopause has really been gaining momentum over the last decade or so. And obviously, it was, traditionally quite a taboo subject, I think that's fair to say. But obviously these days, things are really starting to kind of ramp up a bit, and it's becoming quite a sort of more frequent topic of conversation, and a lot of education, and is kind of sort of being built around it, really, so that we have that awareness, really, and really important for employers and organisations to look at that. So as Jenny already said, the session will form an important part of our, or does form an important part of our Wellbeing at Work training offer. We have dates available to book on our Wellbeing at Work website. So four sessions across the year that people can actually book onto. But again, like Jenny said, we do offer bespoke sessions if any of our organisations, you know, would like to sort of have a bespoke session in their workplace. We can offer that. So there you go. Okay, so for those of you who don't already know me, my name is Nita Dodd. I'm a registered mental health nurse working as a health improvement practitioner with the Wellbeing team. And the main part of my role is to deliver training in mental health and suicide prevention. So that's kind of my main focus really within the team. And this presentation aims to provide that basic overview of the menopause and how it can impact on us in the workplace. So it's like I say, it's kind of that sort of first sort of step really for anyone who's kind of interested in you know, the menopause, what it is, and just that kind of basic overview really. And I do sort of give you kind of links to sort of at the end of the slide, about three slides worth of links that you can then sort of go on if you have that more interest and would like sort of more detail around the menopause. There will be those opportunities. And as Jenny said, there's an opportunity kind of, you can pop your hand up during the session if you like, but I gather there's quite a few on the call on the meeting today. So, you know, messages or comments in the chat bar would be really good. But I've got my colleagues Jenny and Shawnee sort of in the background kind of monitoring that for me as well. Okay, right, so if everyone's happy, I will move on. All right, so first of all, what is the menopause? This is what we're going to be looking at across the presentation today. We're going to be looking at those signs and symptoms, which are obviously quite well documented, and what we can do to ease those symptoms. And then we'll be looking at why the menopause is a workplace issue, and that's kind of where we are today, really. You know, what is it? So why is it a workplace issue? And then again, what are the workplace issues? And a little bit around the law. And what employers can do, and that's obviously really important. I guess there are employers and organisations on the call today that will be interested in that and where they can sort of find more information. And that's what I'll be doing. We'll be looking a little bit at the research and signposting to further training and information, as I've already said. Okay, so that's what we're covering today. I hope that's kind of what people are expecting. So with no further ado, we will move on. So what is the menopause? We have a definition here for mental health at work. And in China, the menopause is known as the second spring. So you may have heard that before. And it's regarded as a time when women often find a new and more confident voice. Women at their midlife are valued for their wisdom and respected for their life experience. Menopause is considered to be a new and sure-footed beginning, which, I mean, absolutely sounds great to me. I think the menopause can be an opportunity for us all. And with the, you know, childbearing years behind us, it's time to put ourselves first, or at least a little bit higher on the list. And as the sort of sorry. I think that's a good example of a menopausal moment, actually. I've just kind of completely gone blank. But yeah, in front of you, the slide is basically sort of saying a little bit about, you know, what the menopause is. So the menopause is not an illness or a medical condition. It's a completely normal life event for women. However, the troublesome symptoms that the menopause can bring are frequently under-recognised, undervalued, and not taken seriously. Symptoms such as brain fog, hot flushes, mood changes and fatigue not only affect work life, but also home life and relationships. And more information can be found from Mental Health at Work. So that's where this quote comes from. Okay, so hopefully that kind of sets the scene quite nicely for our session today. Right, so what is the menopause? So here we see that the menopause is a natural stage, transition stage in most women's lives, and usually occurs between the ages of 45 and 55. It is marked by changes in hormones, estrogen and progesterone, and is usually the time where when there have been no menstrual periods for 12 consecutive months. Women may also experience a wide range of physical and psychological symptoms, which may vary in severity. some women sort of go through it quite, quite easily without any sort of major symptoms. Others do sort of feel the full force of the symptoms that they can experience. Okay, so right, so prior to the normal menopause, which we've said, usually sort of hits around sort of 45 and 55, around the average age of 47, women can or do experience perimenopause for around 4 or 5 years before. So hormone levels fluctuate and the menstrual cycle becomes less predictable. Some women experience premature menopause, which means that when the menopausal symptoms happen before the age of 40, they start sort of feeling some symptoms that they're kind of not sure what they could be, and it sort of gradually dawns on them. In fact, it could actually be a premature menopause. Sometimes due to premature ovarian insufficiency, POI, this could be something that sort of happens as a result of a medical or surgical procedure, such as chemotherapy, radiotherapy, or even a hysterectomy. So perimenopause, like I said, it's that time that sort of things are starting to kind of fluctuate a little bit in terms of hormones, and the menstrual cycle becomes less predictable. So premature menopause, 1 in every 100 will experience these before they're 40, and as I've already said, if there's a medical and surgical menopause, could be sort of around ovaries being damaged by certain treatments or medical interventions. Okay, right. I'm going to leave this with you for a little while. Just have a look. It may be one that you've seen before. I've seen it sort of used before, and lots of different kind of menopausal issues that people experience. If you sort of feel there's anything missing there, and I know there definitely is, because I've run this session a few times now, and there's always quite a few other symptoms and signs that people kind of are able to pick up. Perhaps if you put those in the chat bar, and then we can sort of have a look at those as well. Just give you a couple of minutes to do that.
So we have aches and pains.
Yeah.
Burning tongue.
Burning tongue, okay.
Feelings of self-worth. Forgetfulness.
Yeah.
Tingly head.
Okay.
Dentist said that there are changes to gum and ulcers on tongues.
Okay.
Dry mouth, tiredness.
Yeah.
Restless legs.
Yeah. Yeah, definitely. Any more before we move on?
Migraines.
Yeah.
Skin changes.
Okay. So, I mean, I think the ones on the slide there are kind of probably some of the more obvious ones are kind of included, and then a few not so sort of well-known, shall we say, and certainly some of the ones that were put in the chat bar earlier as well. A couple that I'd not sort of heard of, but thinking about it now, yeah, quite sort of. I think there's so many signs and symptoms that come under the menopause now, and as our knowledge around it grows, sort of certainly in the last kind of, I suppose, decade or so, that we are sort of finding more signs and symptoms that we can actually attribute to the menopause as our bodies change. So thank you very much for those of you who contributed. Okay, so talking about what we can do to help ease some of those symptoms. And obviously, a good starting point is to kind of, talk to your GP, nurse or pharmacist. That's kind of the first line, I guess, for people to follow. And it's always good, if you're going to go do that, to go armed with some information and an idea of what you're looking for in terms of support, and kind of a sort of, you know, some questions, a list of those symptoms that you're experiencing, you know, sort of going with as much information as you can, which can help. So nurse practitioners, obviously, it doesn't need to be a GP necessarily. Nurse practitioners have a wide range of knowledge around the menopause. And these days we're also being told to consult with pharmacists more, who have quite an extensive knowledge. So, you know, those sorts of things are worth a try as well. HRT, so some can take, you know, it can take a bit of patience sometimes to get the dose right. And some women obviously aren't able to take HRT because of medical reasons. But this is something that more and more women are sort of you know, taking as a treatment. And there are various ones that can sort of be offered. So really worth sort of you know, finding out a bit more about that if that's something that you feel may be helpful. I've got CBT in here because talking therapy can help with low mood and those feelings of anxiety that often come with menopause, and obviously those sleep problems as well that we can experience. In fact, 3 in 4 women experience insomnia as a result of menopause. So that was found in a recent study. You've got all sorts of herbal remedies, and obviously looking at supplements as well. I mean, lots of different supplements on the market, but obviously it's worth talking to your GP before you start sort of taking anything, particularly if you're already on medication. Sometimes these can actually interact with sort of medication you're on. But all of this is very individual. I mean, you know, what works for one might not work for everybody else. And again, it's very important to mention about diet as well, the calcium-rich food, milk, yogurt, kale, to keep your bones healthy, because obviously as you're kind of losing estrogen over time with the menopause, you know, that can impact on our bones. So that's really important to kind of keep those, to keep an eye on your diet, really. And again, that word exercise or being active, excuse me, you know, trying to include those weight-bearing activities where your feet and your legs support your weight, like running, walking, dancing. Yeah, I mean, whatever kind of sort of suits you, really, but anything that kind of keeps you moving, keeps you active. And sometimes that's really difficult because obviously we do sort of find it, you know, as a result of menopause and some of the symptoms we experience, you know, it leaves you feeling kind of low in motivation and energy. And that's something that then kind of, you know, means the last thing you want to do is be going out to an exercise class or doing, you know, walking the dog or whatever. But it's about not being too hard on yourself. It's talking to other people who are going through the same thing, family, friends, colleagues. And quite often it's interesting, actually, when you do start speaking to other people, how many other people are going through the same thing. So always worth kind of doing that as well. And that's certainly something that we promote within Live Well, with our sort of hot flush drop-in sessions that we have for our employees. Okay, so why is the word menopause a workplace issue? So 71% of women are in work, and that's nearly 8 out of 10. So 8 out of 10 employees, or women rather, are in the workplace. Typically, healthcare organisations such as Live Well employ around 2/3 more women than men, many in that 45 to 55 age range where menopause is most likely to happen for them. In some shape or form. 48% of the workforce are women in the UK, so that's obviously kind of half the workforce are women. That kind of goes without saying, really. And 3.5 million employed women in the UK are over 50. So, and the number of women working at age 70 actually doubled in the last 4 years. Those statistics come from the Department of Work and Pensions back in 2017. So to think that kind of, you know, we are sort of having an aging workforce in some ways, and that, you know, those people have got a lot of experience, a lot of knowledge. They've been around in the workplace for a long time. So really important to kind of make sure that we're looking after those people, really. And while everyone experiences it differently, 45% of women say their symptoms have a negative impact on their work. And statistics show that around 1 million women have left their jobs due to the menopause. And I wonder if that surprises people. Certainly, if you've got any feelings about that, as I said, pop things in the chat bar if you'd like to. But yeah, so it really does, I think this demonstrates quite nicely, really, that it's so important to get this right, to kind of support people, women in the workplace who are experiencing menopausal symptoms, because they are such a valuable part of the workforce. So yeah, really good that we're kind of really growing in our experience and knowledge and education around this. Okay, right. So what are the issues experienced by menopausal women in the workplace? And again, I mean, if you kind of have a look at this list here, and I'll kind of go through that. If you think of any others, feel free to pop those in the chat bar as well. But fear among employees not feeling comfortable to discuss their issues with their manager. There's inflexible policies that can be in some organisations which actually penalise women because their symptoms, they're sort of thinking, oh, well, they just got to get on with it kind of thing. There's that kind of attitude, unfortunately, that still exists. Those excessive workloads that maybe sort of people are having, particularly at a time when, maybe a lot of people are leaving sort of kind of the workplace. And then what happens, making sure that we've got really good succession planning to make sure that people are put in place to cover that, rather than existing kind of staff having to kind of cover and make their workloads more sort of difficult, really. So that workplace stress that kind of comes out of that. And the lack of awareness about the menopause among managers and colleagues. So really important, like I said, to make sure that we're doing more around that. Perhaps the lack of management training on women's health issues, and those negative attitudes or unsympathetic lines from managers and colleagues. And in some cases, those bullying and harassment type behaviours that can happen. If you have any more that you'd like to add in the chat bar, please do. So obviously, we've got a lot of people on the call today, so it'd be really good to hear from you if you feel I've kind of missed any. Give you a couple of minutes to do that. Just thinking of your own experience or things that you've seen sort of happening, things you've heard. Or have I covered everything?
Not directly workplace related, but menopause often coincides with parents becoming less able-bodied and children leaving home. Embarrassment, uniforms, lack of progression as well.
Okay. So lack of opportunities for progression, is that?
Access to toilets and showers, hot working environment.
Mm-hmm.
Yes, lack of opportunity. Yeah.
Yeah. Okay. Thank you. Yeah. Interesting. Okay. Well, thanks very much for those comments. Yeah. So those experience. I mean, I don't know how people feel about this, but certainly those experiences. People having experienced in all of these, or some or all of these kind of issues in the workplace is obviously quite. It's a shame. It's quite sad that that's kind of happening still, but hopefully as time goes on, we will find, with the education and training that we give people, that will actually improve. Okay, so thanks again for those who came forward with some comments. Right then, so moving on. What does the law say? So the menopause is not a specific protected characteristic under the Equality Act 2010, but if an employee or worker is put at disadvantage and treated less fairly less favourably because of their menopause symptoms, this could be discrimination if related to one of the protected characteristics. So, for example, age or gender. Health and safety at work. The Health and Safety at Work Act 1974 is in place to ensure the health and safety and welfare of all workers, and obviously this includes the menopausal women. Perhaps at that time, when in 1974, menopause wasn't such a high profile topic, but certainly, work under the Health and Safety at Work Regulations 1999, employers have a duty to make suitable and sufficient assessment of the workplace and the risk to health and safety of their employees. So this includes identifying the groups of workers who might be particularly at risk, and that obviously includes menopausal women. So I wonder if there are any surprises there. So it's not that it currently comes under is a protected characteristic under the Equality Act 2010, but certainly some of the kind of issues that come out of that can be can sort of come under that act. So it's interesting. I mean, I was looking at I get various newsletters coming through about the menopause each day, and this morning my Menopause Matters newsletter kind of told me about an employment tribunal hearing that's kind of ongoing at the moment and will actually due to be heard this week, where the lawyers, and that's up in Leicester, lawyers of a 52-year-old woman will say that she was discriminated against on the grounds of disability and sex. So she was actually a social worker, and her hearing, they've actually gone to a tribunal, and there will be a hearing this week about that. So interesting how that's going to be one of those kind of what do they call, groundbreaking sort of events that kind of happen.
Test case.
Test case, that's the one. Thank you. Thank you, Jenny. That's it. A bit of mind blocking there, but yeah, so really interesting that employers and organisations really need to sort of be thinking about what they can do in terms of, obviously, with the law kind of being increasingly more proactive around this, really. And also recently, this was from Menopause Matters again, which I really kind of recommend to people. A Scottish woman received a £37,000 payout after her boss said that she'd used the menopause as an excuse for everything, and various other things. You'd have to read the article to sort of find out more detail, but she actually ended up suing the company for unfair dismissal and harassment. She actually left, but it was kind of came under like a constructive dismissal sort of thing. So yeah, anyone who's really interested in that, there is a lot of legislation out there, and lots of things happening, lots of test cases, thank you, Jenny, that are happening. So really important that we kind of get this right, and that managers and organisations kind of do sort of check this out, really, and perhaps look into it a little bit more. Okay, so on that subject then, what can employers do? So developing a menopause policy, which gives clear guidance for managers, which incorporates all of the following. So providing education and management for staff, such as menopause awareness training, and incorporates risk assessments and wellness action plans into line management and supervision meetings, so that we can actually look at those reasonable adjustments that could be made. So when we're sort of having line management, we're actually kind of looking at, okay, what's going on? What can we do? Are there any reasonable adjustments that could be made for this person to make their life easier at work? So managing those excessive workloads and trying to limit that stress, which is what we were talking about earlier. Somebody said about sort of hot offices and things and stuffy work environment. So ventilation really important. Access to fans, and also somebody mentioned uniforms as well, so that appropriate kind of PPE and uniforms which don't sort of get some of those uniforms that are really kind of the material makes people quite sort of hot and sweaty, so really looking at what can be developed to kind of make things a little bit easier for people, and just adopting that culture whereby people are encouraged to take work regular breaks, and I think that's important. But line managers and management sort of have a duty of care to their employees, by role modeling, what are the expectations. We expect people to take regular breaks. It's really important for our health and self-care, and obviously not just menopause as well. So, across the board, that is something that is being promoted. And establishing those points of contact as well within the workplace to improve access to support, encouraging the development of menopausal cafes where issues can be discussed and shared. And I mentioned earlier that in Live Well we have something called the Hot Flush Group. I don't know if we have any members on the call today, but yeah, really good. I've been to a couple of those. We have an online session, and we also have a face-to-face drop-in session as well, where women can sort of go and just kind of talk about what's happening for them and sharing sort of ideas, tips and that sort of thing. So really good to get that sort of rolling out in organisations as well. And just, it's all about encouraging a culture where menopause can be discussed safely by creating more awareness among managers and colleagues, and using those internal comms as well. I don't know if we've got people on from comms today, about reducing the stigma and encouraging the conversation. And also recording menopause sickness absences is felt to be quite a good practice for employers as well. I don't know how people feel about that, but I know ACAS recommended this to all sectors. And that's, it is a practical HR step that businesses can take, and it's good to sort of be able to monitor what's going on as well and put measures in place. So also sort of, a lot of organisations, particularly those who are perhaps signed up to the Wellbeing at Work Awards, there's a bit of a plug there, in their annual Wellbeing survey, do people ask, is there kind of a mention of questions around the menopause in that annual Wellbeing survey? Another really good way for employers to kind of find out what's happening within their workplaces. And then obviously I mentioned earlier, World Menopause Awareness Day, really important to use that as a permanent fixture campaign in your organisational diary every year to sort of build in things around that. And certainly in Live Well, we do that as well. So anything that kind of builds awareness. And there's better investment in comfort facilities and providing emergency period toiletries, always really kind of useful, and shows that employers are really valuing their staff and have an awareness of what issues can be faced, particularly by, by women generally, but also by, particularly by menopausal women. So it's all about kind of, having that new, promoting a good culture around it, really. And then challenging those negative attitudes as they happen. I guess some people on the call may have experienced kind of a negative comments when they perhaps sort of actually said that they're struggling with menopausal symptoms at the moment, and sort of interesting to know if people have experienced anything like that. So those are just a few things that I feel that employers can actually do, and I'm sure there are a lot more as well. I don't know if people heard of wellness action plans, which can be used in line management as well. And it's kind of using those so that people can really identify what's going on for them at the moment, and what reasonable adjustments can be made around that, really. It's not necessarily going to be a long-term issue, but it's certainly kind of valuing, the people that are working within your organisation, and sort of giving that message that you are happy to, you are willing or happy maybe to make improvements around, what would make their working life sort of more, easier. And that awful statistic we saw earlier, where women are actually leaving, 1 million have actually left their job because they felt that they couldn't sort of carry on, really. So yeah, some really sort of good food for thought there. What have I done? Have I just gone forward? There we go. Right. Okay. So any others? I mean, if people just sort of, I won't sort of stop for people to do this, but certainly as we go, if there's any comments that you would like to pop in the chat bar, please do, and we can sort of look at those perhaps at the end. Okay, just to say also about the menopause policy as well, we've certainly got a really good one in Live Well that was kind of developed with sort of management and the unions actually, who played quite a big part in getting it sort of, getting that arranged. So having that menopause policy, and we can certainly, there's lots of examples of really good ones that people could sort of use if they want to develop their own policy. Okay, so moving on then. So in August 2022, the Women's Health Strategy for England detailed the government's 10-year ambitions and actions that we are now taking to improve the health and well-being of women and girls in England. So people might have already heard of that. So it's an actual 10-year strategy. So that was in 2022. So 10 years that, you know, or out of strategies that have been outlined for us to kind of improve the well-being, health and well-being of women and girls in England. And as part of this work, the UK Menopause Task Force was established to improve holistic support for the menopause across the UK through its focus on 4 key areas. And those 4 key areas are, as outlined in my slide there, so healthcare provision, education and awareness for the population and healthcare professionals, that workplace support, and research, evidence and data. So really good to know that the UK Menopause Task Force is improving that holistic approach and support for women. So I'm not sure if anyone's kind of heard of that before, but lots going on really behind the scenes that kind of supports employers really around providing, you know, if it's there in black and white, it's part of that health strategy for England. You know, the support is there from above really to, you know, say what is needed. Okay, so what next then? So the menopause awareness 3-hour session is still, I understand, available. I thought I'd updated this slide, but I've made a schoolgirl error here. The Live Well Training Network is no longer, so the South West Academy is no longer sort of in existence. They now come under Live Well as the Live Well Training Network. And I recently sort of checked that this training is still happening. So if anyone wants to kind of a bit more detail, as you can see, there's a lot more detail, which really it's kind of aimed at managers, team leaders, menopausal people as well, just anyone really who wants more information on the topics. As I said, this is a kind of an awareness session that we're running today. So if people do want sort of more detail, a more detailed look at the menopause, then the Live Well Training Academy. I don't know if one of my colleagues is able to pop the link for that in the chat bar. Maybe, but we'll certainly sort of try and get it to you by the end of the session, or perhaps after that. So if there's anyone who's interested in that training. Okay. Right. Moving on. So you may have heard of the Wellbeing of Women Workplace Pledge. So NHS England and Live Well South West have recently signed up to the Wellbeing of Women Menopause Workplace Pledge. By signing the pledge, you'll be committing to recognising that the menopause can be an issue in the workplace and women need support. So it's about that recognition. And also by signing the pledge, you are talking, you know, you're sort of saying that you will talk openly and positively and respectfully about the menopause in the workplace, that you'll be actively supporting and informing your employees affected by the menopause. And on the bottom of the slide, I put you can make your pledge by clicking here. So people can actually, these slides are available for people to can I just check with Jenny? Are they on the menopause, the Wellbeing at Work website, or do we need to sort of send the actual slides out to people after? What's the
we'll be sending all the slides out afterwards, and we'll also send out the Live Well South West menopause policy and also the link to the Live Well South West training on the more in-depth menopause after the event.
That's great. Thank you very much, Jenny. Much appreciated. Okay, so all good. So all information to be provided. Okay, so moving on. as I've already said, I mean, October every year is Menopause Awareness Month. The actual day is the 18th, and on the 18th we do have a session or an event that's happening at the New Continental. Perhaps Jenny could sort of chip in again about that one at this point, just to kind of, a bit of a plug opportunity.
Yes, for those that missed the update at the beginning, it's just to say that we have an event at the New Continental 10 till 2. We have 36 partner stands delivering and showing what's going on in terms of health and well-being in Plymouth. So you can pop along and see what's going on. And there's free tea, coffee and fruit. And obviously we'll be there from a wellbeing at work point of view as well. We've got, I think, 250 people coming so far, and there's still space for many more. So do pop along and see what you can pick up there.
Brilliant, thank you, Jenny, and I'll be there as well as part of the because obviously I'm part of the Wellbeing at Work team. So if anyone wants any sort of further discussion around the menopause or support, feel free to pop over and say hello. Yeah, but obviously, what will you be doing to support, really? I mean, I think, hopefully coming along to the event at the New Continental on the 18th, but what could your organisation be doing, to sort of celebrate and promote that awareness around the menopause on that day, or during that week, or even during the month? It's obviously a whole month that we've got an opportunity or an excuse, really, to sort of put some plans in place. Can I just ask people at this point to put some suggestions in the chat bar? So what have you already got plans to be doing anything? Obviously, bearing in mind we are actually in October, and are any organisations got any special events that are happening, or things that they would like to sort of let everybody else know about? I'll give you a couple of minutes just to pop a few things in the chat bar. Basically, what are you doing to support Menopause Awareness Month, week, day?
One said, I didn't know it was a day, so nothing planned, unfortunately.
Okay, now you do.
We will have some posts coming out on our social media as well with some tips and ideas if you'd like to check them out on the day. Maybe do something after the 18th. It doesn't have to be on the 18th, but
Absolutely.
someone will be planning something now.
Okay, brilliant. Good to know. Big thumbs up there. But good idea there about the comms. I mean, I guess a lot of organisations, or perhaps the bigger organisations have got teams, perhaps, or someone who develops the comms. I mean, even kind of putting things, the sort of on our laptops and things, we sometimes kind of get sort of information that kind of comes through as part of our screensavers, and just obviously in newsletters and things like that as well. Anything else there, Shawnee?
No, nothing else is coming
Nothing
through.
else on the chat bar?
Oh, maybe share your menopause policies for staff to read.
Right, okay. Yeah, I mean, certainly all policies are in the public domain as far as I'm aware. And we think it's important that people do sort of share the information. We're all in this together ultimately. So really good to do, good practice to kind of share information where possible around the menopause, and what organisations are doing and what they're finding out, really. So hopefully today people will sort of be aware, be a bit more aware about what's going on, I guess. Anything else before we move on? Nope. Okay. Right, we're sort of coming to the end of the session now. So I've got, as I said at the beginning, you know, I have got sort of lots of signposting here available for people that you can sort of follow once we're finished today. So the Wellbeing of Women Workplace Pledge is the one I've already mentioned about. Menopause Matters website as well, which I said because I've had a few kind of extracts from at the beginning there. And you can basically sign up to their free monthly newsletters. And there's a few websites and organisations that do that. So NHS menopause information is really good. And Unison, the Menopause and Work a Unison guide is really good as well for people to have a look at. So any of those, lots of information, especially if you're developing your own policies, to have a look at. Okay, so the DAISY network for information around premature menopause, that's a really good one there for people to have a look at and get some more information. Menopause cafes, there's an actual website around that as well, so it gives you lots of hints and tips about what you could be doing. The Women's Health and Concern, they provide confidential and independent service to advise, inform and reassure women about their gynecological, sexual and post-reproductive health. There is also Queer Menopause, which is obviously their mission is around raising awareness of the LGBTQIA+ menopause. And gov.uk, the Women's Health Strategy for England, which I've obviously already mentioned as well. So some really good resources there that are kind of, and these are just a few. I mean, this was kind of when I developed the presentation last year. So since then, there's going to be lots more out there for people to look at. But certainly the gov.uk Women's Health Strategy for England, like remember I said the 10-year plan that they've got around sort of improving the health and well-being of women and girls in England. Okay, and again, more signposting here. So Live Well Menopause Policy, I've already mentioned that, really good policy. I think that one's up for review actually, so we'll be looking at reviewing that sort of shortly in the light of recent developments and things. Plymouth Options Support as well, really good sort of stress, sleep, meditation as well. You can kind of self-refer to that. They have kind of groups available that people can go to. So we got, so have I mentioned the Women's Health Strategy for England again? See, I'm so impressed with that when I put it again, you see. And Henpicked is so part of the strategy is something called Henpicked as well, which is another one that people can look up. So it's about the change for the better, improving wellbeing at work, and also menopause fact sheets that can actually be found on our Wellbeing at Work website as well. So if people want to have a look at that. And I just want to have a quick plug as well for a book by Davina McCall called Menopausing, which Davina wrote in consultation with a doctor, Dr. Naomi Potter. And it's, it's at the front, it sort of says it's the positive roadmap to your second spring. So Menopausing, a really good book if anyone wants to have a look at that. I quite often kind of refer back to it if I'm looking for a bit of information. Davina kind of provides all of the kind of the case studies and the sort of the true life stories that perhaps people have that they want to talk about, and then Dr. Naomi Potter provides the science really in the medical side of things. So really good, really, if anyone's kind of interested in that. Okay, I guess it's online as well. Okay, right, so thank you for listening today, and hopefully you found this session useful and have learned something that you didn't know. If you just have one little thing to take away from today, then that's for me, that's kind of a positive thing. And again, it's our link to the Wellbeing at Work training website. So if you have any other training interest, then we have a lot of training available to offer within our team. quite a substantial list. Some of it there is a small cost to, which just covers resources, so booklets and that kind of thing, and others which are free. In fact, the vast majority of our training on the Wellbeing at Work website training page is free, and there's all sorts of things on there that people might be interested in. So do come and have a look and see if there's anything that you would like to be involved in. Okay, so thank you again, everybody, and good luck. Enjoy the rest of Menopause Awareness Month, and hopefully we'll see some of you at the event on the 18th of October at the New Continental. Thank you. Bye.
Thanks, Nita. Thank you very much. Thank you, everybody.
Bye.
Thank you. Bye.